As of tonight, state health officials say the average turnaround time for a COVID-19 test is between 2 and 3 days.
As coronavirus case numbers continue to rise again in Michigan, 7 investigator Heather Catallo digs deeper into the science and the relationships that contribute to the time you have to wait for your results.
How much time it takes to get your COVID test results back can vary greatly. It all depends on the lab that a testing site is using.
I did it the week before I was going to go see my family in Illinois.
Health experts say testing and mask wearing are some of the most important tools in fighting COVID-19. But when it takes multiple days to find out whether your test is positive or negative, being proactive can seem pointless.
I didn't get my results by the time I left, so it sort of defeated the purpose.
While Detroit's COVID-19 numbers have stayed low during the past few months, getting test results on time still can be a tricky science.
When we went to BioReference, there was no one in Michigan that had it, that could do it, and the testing kits were not there. So that's how we've established that relationship.
Hakeem Berry is Chief Operating Officer for the city of Detroit. Berry helped put together Detroit's testing site at the state fairgrounds this past spring. They contracted with New Jersey-based BioReference.
As our numbers went down, everywhere else in the country went up. So that's when our test results started taking 7 days because they were being slammed by other hot areas.
The more capacity a given lab has, the more samples get sent to that given lab, and it overwhelms the lab.
Dr. Phil Levy is running a testing site through Wayne State University. He says larger, high-volume labs can sometimes mean longer wait times.
Everybody looked to the big lab companies first. They became overwhelmed, and there wasn't the ready accessibility of these smaller labs to run the tests.
Dr. Levy says if we used local labs, turnaround time could be 24 to 48 hours. But you have to know that the labs exist.
The relationships that we've developed with labs have come either through somebody who knows somebody or somebody who's heard that we're in the testing business.
Alan Mack's company, NextGen in Grand Rapids, works with Wayne State. They used to focus on genetic testing, but they quickly transitioned to COVID-19, increasing their testing capacity to handle up to 9,000 tests a day. Right now, they're only processing about 2,500 tests daily.
We didn't have some magical Rolodex that put us in touch with all the hospitals and all the other laboratories.
Mack says he even reached out to one of the bigger national labs doing work in Michigan back in May and offered to help process tests.
I call it a BFN. I call it a big fat no. They told us they don't need our help. And at the same time, there are a lot of patients waiting 2 weeks for the results.
While big testing labs have been inundated, Mack says there are other factors that cause delays. Testing supplies can still be scarce. Just last week, Henry Ford Health System told the state that while they had the capacity to turn around 1,500 tests a day, supply constraints reduced that number to only 670 tests.
Theoretically, if a hospital is at their capacity, it should be okay for them to send a test out to another laboratory to perform the overflow.
But Mack says Michigan is a no markup state. That means hospitals can only charge what a lab is charging for a test.
It amounts to about a $23 per sample loss when they send these samples out. And if they're having to send thousands of these per day, well, that adds up very quickly.
While the city of Detroit has partnered with smaller local labs to ensure speedier turnaround at nursing homes, systems like the State Fairgrounds site, which has now moved locations, are likely going to stick with the big labs.
It's really hard to unravel everything that we've done and built to maybe work with a different lab. We have such a infrastructure with the technology.
Regardless of how many days it takes to get your test results back, health experts say regular testing for COVID-19 is still one of the best ways we can stop the spread of the virus. Reporting in Southfield, I'm Heather Catallo, 7 Action News.
All right, thank you so much, Heather. Let's